Centre asks states to take care of COVID protocol while unlocking in view of seriousness of the next wave. States should decide to impose or remove ban, keeping in mind the ground reality, and adopt a 5-point strategy for COVID control. India crosses major landmark with cumulative vaccine coverage of 27 crore. Over 97,000 patients recovered during the last 24 hours. Daily recoveries continue to outnumber daily new cases for the 37th consecutive day. Vaccination of citizens in age group of 30 to 44 years to start from today in Maharashtra. Finance Ministry refutes news media reports of alleged black money held by Indians in Switzerland. Information sought from Swiss authorities to verify increase or decrease of deposits. India's ambassador to the UN, T.S. Tirumurti, says India will continue to engage with measures to accelerate and support the democratic transition in Myanmar so that hopes and aspirations of people of Myanmar are fully respected and met. UN Secretary General Antonio Guterres pushed the General Assembly to tell Myanmar's military that democracy must be reinstated, political detainees must be freed, and human rights abuses and killings must stop. Former Indian sprinter Milkha Singh, widely regarded as Flying Sikh, passed away last night. He was admitted to ICU on June 3rd due to dripping oxygen. On May 20th, he had tested positive for COVID-19. President, Vice President, Prime Minister and other dignitaries extend condolences. Last rites to be performed today in Chandigarh. Rain shadows the second day of the World Test Championship finals between India and New Zealand in Southampton, England. First day of play called off. Good afternoon and welcome to this bulletin. I'm Shubhendu Ghosh. Union Home Secretary Ajay Bhalla has written to Chief Secretaries of all states to ensure that there is no complacency in adhering to COVID-appropriate behavior and in the test, track, treat vaccination strategy. The letter comes as several states are relaxing their COVID-19 curbs in view of declining trend in daily new cases following surge during the second wave. In the letter, Secretary has highlighted that decision to impose or ease restrictions has to be taken based on assessment of the situation at ground level. While the opening up of activities after a decline in cases is essential, states and union territories must ensure that the whole process is carefully calibrated. Home Ministry added that five-fold strategy of COVID-19 appropriate behavior includes the mandatory use of mask, hand hygiene, social distancing, and also proper ventilation of closed spaces. Regular monitoring of these protocols is required to prevent a relapse of pandemic situation in the country. Union Home Secretary also asked states to keep a close watch on the early signs of a surge in active high positivity rates, as well as continuing the strategy of test, track, treat, highlighting the need for COVID-19 vaccination. Home Secretary said that successful immunization drive is essential to break the chain of transmission. Therefore, all states, union territories, governments should step up the pace of vaccination to cover the maximum number of people in an expeditious manner. India continues to witness declining trend in the new daily COVID-19 cases. Active cases in the country have been lowest after 74 days. In the last 24 hours, 60,753 daily new cases were reported. India now has 7,60,019 active cases of COVID-19. Daily recoveries continue to outnumber daily new cases for the 37th consecutive day. 97,743 patients recovered from COVID-19 in the last 24 hours. So far, a total of 2,86,78,390 patients have recovered from COVID across the country. The country's recovery rate has increased to over 96%. Weekly positivity rate remains below 5% and currently stands at 3.58%. Daily positivity too has been less than 5% for the 12 subsequent days. It is now at 2.98%. India also continues to cross milestones as far as vaccination drive is concerned. 27.23 crore vaccine doses have been administered so far under nationwide vaccination drive. Of this, more than 33 lakh people were vaccinated in the last 24 hours. The central government continues to provide COVID vaccines through free of cost channel and through direct state procurement category to different states and union territories. In total, over 28.50 crore vaccine doses have been provided to the states and union territories so far, and of this, the total consumption, including wastage, is around 25.63 crore. So that means over 2.87 crore COVID vaccine doses are still available with the states and union territories to be administered. Furthermore, 52.26 lakh vaccine doses are in the pipeline and will be received by the states and union territories in the next 3 days. Meanwhile, testing for COVID-19 continues in the country unabatedly to restrict the spread of the virus. On Friday, as many as 19,02,009 samples were tested in India. A total of 38,92,07,637 samples have been tested in the country so far for COVID-19. The Finance Ministry has refuted news media reports of alleged black money held by Indians in Switzerland. According to certain reports in media stating the funds of Indians in Swiss banks have risen to over 20,700 crore in 2020 from rupees 6,625 crore at the end of 2019. The ministry has said media reports allude to the fact that the figures reported are official figures reported by banks to Swiss Bank and do not indicate the quantum of much debated alleged black money held by Indians in Switzerland. Also, the statistics do not include the money that Indians, NRIs or others might have in Swiss banks in third country entities' names. However, the customer deposits have actually fallen from the end of 2019. The funds held through fiduciaries has also been more than halved from the end of 2019. Meanwhile, Finance Ministry has sought information from Swiss authorities and has requested to provide relevant facts and their view on possible reasons for the increase or decrease in the deposits by Indians. Secretary in Department of Industry and Internal Trade, Dr. Guruprasad Mohapatra, passed away today. He was being treated for COVID-related complications. An IAS officer of the 1986 batch, Mohapatra had assumed charge as the Secretary of the Department for Promotion of Industry and Internal Trade in August of 2019. Prior to taking over as the DPIIT Secretary, Dr. Mohapatra served as Chairman of the Airports Authority of India. He was also Chairperson of Invest India. President Ram Nath Kovind has condoled the passing away of Dr. Guruprasad. In a message, he said, "Pained to learn about the untimely demise of Dr. Guruprasad Mohapatra, DPIIT Secretary, an outstanding bureaucrat. His work ethics and dedication to public service will remain worthy of emulation. My deepest condolences to his family, friends, and colleagues." Vice President M. Venkaiah Naidu has condoled the demise of Dr. Guruprasad Mohapatra. In a message, he said, "Anguished by the passing away of Shri Guruprasad Mohapatra, Secretary, DPIIT and former Chairman of Airports Authority of India. He was a distinguished civil servant who worked extensively in the power sector, industry and urban development. My condolences to his family." And Prime Minister Narendra Modi has expressed grief over Dr. Guruprasad's demise. In his message, he said, "Saddened by demise of Dr. Guruprasad Mohapatra, DPIIT Secretary, I had worked with him extensively in Gujarat and at the centre. He had a great understanding of administrative issues and was known for his innovative zeal. Condolences to his family and friends." Commerce and Industry Minister Piyush Goyal conveyed his deepest sympathies to his family and friends. In his message, he said, "Extremely saddened to hear about the loss of Dr. Guruprasad Mohapatra. His long-standing service and dedication to the nation have left a lasting impact. I convey my deepest sympathies to his family and friends. Cabinet Secretary Rajiv Gauba said that Dr. Mohapatra was a dear colleague and an outstanding civil servant with exceptional qualities of strategic thinking and leadership. He also extended his deepest condolences to the members of his family.
Dr. Mohapatra's untimely demise is an irreparable loss for all of us. As Secretary DPIIT, he was implementing several important initiatives, and over the last 15 months or so we worked very closely in government's fight against the COVID-19 pandemic. He was heading one of the empowered groups which government had set up to deal with various aspects of the pandemic, and he was working tirelessly even when he was unwell, himself down with COVID-19. He continued to work till long hours to increase the supply of oxygen and ensure its movement, its transportation to different parts of the country. His contribution was immense, invaluable.
Additional Secretary DPIIT Sumit Daura has condoled the passing away of Dr. Guruprasad. In a message, she said, as chairman of Empowered Group 2, he proactively planned oxygen supply for the country through an institutionalized framework that smoothly facilitated each state and union territory to source oxygen for their needs. He guided the team to deliver beyond what we thought was possible, as the country delivered 10 times the normal amount of medical oxygen on a daily basis to all hospitals during the height of the COVID wave. Even after testing COVID positive and despite running high temperature, he continued to guide over telephonic calls and video conferencing. He chaired the crucial meeting of the Empowered Group to review the supply of oxygen to states on 19th April 2021. It was a few hours before he was hospitalized at AIIMS. A deeply committed officer with outstanding qualities of leadership, foresight, dedication to public service. He has imparted to us, through his personal example, some of the greatest lessons in governance and public service. My sincere condolences to his family. This is a deeply personal loss for the DPIIT family. ASSOCHAM Secretary General Deepak Sood has termed the demise of Dr. Mohapatra as a great loss for the Indian industry.
Saddened to hear the sad demise of Shri Guruprasad Mohapatra ji. He was a very dynamic and a visionary officer with an impeccable track record. Personally, I have worked with him in Gujarat. I have great respect for the man that he was. He was a personal friend, mentor, who guided me personally as well as professionally through the thick of times. It is a terrible loss for Indian industry and for the nation. He shall be remembered for his great work that he has contributed at the national level and at the state level.
Chandrajit Banerjee, Director General, Confederation of Indian Industry, CII, has expressed grief at the loss of Dr. Mohapatra. In a statement, he said, an outstanding officer, passionate administrator. His innovative ideas and proactive initiatives set new models for the Indian economy. He helped guide a number of industry and investment-related policies and engage with investors to resolve issues. CII deeply appreciates the contributions he made to manufacturing sectors, FDI, and ease of doing business as Secretary DPIIT, which will continue to positively impact the industry. We offer our deepest condolences to his family. And Federation of Indian Chambers of Commerce and Industry President Uday Shankar has said Dr. Mohapatra is known for his administrative acumen and his innovative methods of working will always be remembered by us. Union Secretary Road Transport and Highways Giridhar Mane has said that the country will remember his contributions and achievements in the policy planning.
Sri Mohapatra is a very dear colleague and a very committed, sincere officer belonging to administrative service. I have been associated with him for last 4.5 years. I am amazed by his commitment to the developmental programs, especially important policies like Make in India and establishment of manufacturing facilities in the country. It is sad that a person who was working till the last minute for increasing the supply of oxygen to COVID hospitals has succumbed to COVID. I pray for peace of his soul and pray God that his family may be bestowed with the courage to bear the irreparable loss.
And to talk about the legacy of Dr. Mohapatra, Managing Director of Mahindra & Mahindra, Pawan Kumar Goenka is joining us on the phone line. Mr. Goenka, welcome to DD India. Condolences are pouring in for Dr. Guruprasad Mohapatra. How do you see his contribution to the industry and his legacy?
Well, obviously a very sad situation, demise of Dr. Mohapatra. I have known him from the time he became Secretary of DPIIT and worked closely with him, more so in the last 15 months in his capacity as Secretary, and also many things that he was doing on COVID. I have always found him to be very practical, no-nonsense, action-oriented person, always looking to find solutions. At a time when India is trying to really grow aggressively in manufacturing, this is a very big loss for the country. And I really feel sad at this occasion, and I hope that his family is able to bear this loss.
Right. Mr. Goenka, the condolences that are pouring in, we learn about the kind of efficient bureaucrat that Dr. Mohapatra was and his dedication to public service. From your own experiences, if you could share some memories, some examples of the way in which he put service before self towards his work.
Well, I'll just take my last interaction with him, which was just 10 days or 15 days into the month of April, before he was hospitalized. We were working on some of the issues that the committee that I'm on scale was facing in terms of incentivizing the industry. And he right then and there dictated a deal and saying, let's just go ahead and get it done. This is the kind of sort of action orientation he had and speed at which he always wanted to work. We need officers like him in critical positions like DPIIT Secretary, and I really will miss him personally because I've been working very closely with him in the last, as I said, last 1 year.
Right, Mr. Goenka. Also, talking about his sort of contribution to public service, as DPIIT Secretary, what were the structures, what were the reforms that he introduced that are going to have a lasting impact? Because a lot of messages talk about the ways in which he made room for a lot of reforms to come in the times ahead.
Well, as I've been watching many of the officers talking on TV or sending the condolence messages, he was really a very strong mentor to many of the Joint Secretary and Additional Secretaries, and grooming them to be very action-oriented. He was trying to get out of many of the bureaucratic delays that happened in facilitating manufacturing growth, and had succeeded in doing a few things in a very short span of less than 2 years that he was in this position. And he had, one of the strengths that he had was he was very well networked in the IAS, and he could always pick up the phone while in the meeting and try and resolve any issues, any constraint, any roadblock that was coming in moving forward. We need officers like that who are well connected, action-oriented, innovative, trying to find a solution and not trying to say why something cannot be done, but how it can be done. And he was always looking to see how it can be done. So many, and I don't know the inner working of DPIIT, of course, but I'm sure that in his 2-year span, he would have made many sort of changes that would speed up, hasten up the process of manufacturing growth in India.
Right, and one of the contributions, Mr. Goenka, that stands out that we're talking about at the moment, the crisis of pandemic that we're all living through, the nearly impossible task of supplying such large amounts of oxygen to ensure that sort of a supply chain, he closely monitored and managed it, even when he himself was tested positive.
Personally, for anything that he thought I could help him with in any of these things, and was always on top of it, knew exactly what was happening where, and dedicated 24/7 to this task of trying to, the task that was given to him about oxygen. He was working very hard and using all his sort of industry contacts to ensure that the country is over this crisis of oxygen as quickly as it could.
All right, Mr. Goenka, thanks very much for joining us with your thoughts as we talk about the passing away of Dr. Guruprasad Mohapatra, Secretary in the Department of Industry and Internal Trade. Dr. Guruprasad Mohapatra passed away today. He was being treated for COVID-related complications and IS officer of the 1986 batch. Dr. Mohapatra assumed the charge as the Secretary of Department of Promotion, Industry, Internal Trade in August of 2019. This was prior to him taking over as DPIIT Secretary. Dr. Mohapatra served as the Chairman of the Airports Authority of India as well. And as we speak, condolences have been pouring in from President of India, from Prime Minister, Vice President, about the efficient bureaucrat that Dr. Mohapatra was, and the efficiency with which he took whichever sections, whichever groups that he was working with forward. His particular contribution that has been highlighted is towards the supply chain management of oxygen, liquid medical oxygen, during the time of COVID-19. He himself was tested positive for COVID-19, but his commitment to work in public service continued. Joining me now is MD Invest India, Deepak Bagla. The moment, Mr. Deepak Bagla, good afternoon and welcome. We are trying to look at the legacy, the contribution of Dr. Mohapatra. If you could share your thoughts on your memories of the manner in which he took bureaucracy and efficiency and public service to the next level.
This has been absolutely shocking and untimely. Mr. Mohapatra was the chairman of Invest India, and he was a guiding light. We were at our entire planning, and he would see himself getting very deeply involved in how we can create this organization and create it much stronger and create it far more outcome-oriented. And that was him essentially. There was always a solution to anything which you brought to him. There was always an outcome orientation to any issue in front of him. And that is what was one of his biggest strengths, to get everybody together to move in the same direction to make it happen. We will miss him personally, and we miss him immensely as a team. He led us, and there was this personal touch about him. There was always that personal question that how's everyone doing and how's your health? And I recollect till the last moments before he went to the hospital, he was taking official calls. His dedication to his work, to his country, he as a person, it is something we will miss immensely.
Right, and the example of dedication that I've been trying to highlight, sir, is also about how, despite being tested positive for COVID-19 himself, his dedication to public service, ensuring that the responsibility that he's carrying of management, crucial management of oxygen to different states and union territories, that continues unhindered. Talks volumes about the way he looked at his work.
Absolutely. I mentioned even when he was on his way to the hospital, he was taking his last video call on that entire oxygen supply efforts, which he was leading. He would just be at it. There was nothing to do about a day or a night. It was 24/7, despite his health and in spite of everything else.
Right. Also, sir, as
unmatched dedication.
And so your experiences of seeing him work as the chairman of Invest India, what kind of energy, what kind of new possibility ideas did he bring in? Because we know this flagship program has helped India emerge as a leading investment destination in the world.
You know, one of his biggest strengths was to understand about the creation of an institution and strengthening an institution. As you know, Invest India is a very young organization. And I would see in him, and this is where he led us and guided us immensely, about how do you strengthen the organization and institutionalize it, and also to create it in a manner so that it remains very outcome oriented to what is required for the people. And that was one of his biggest strengths, the ability to roll up his sleeves, get deep into details, get everyone's views, and then to come up with a solution which would remain as a very strong and a viable solution. Everything was very practical, and everything had a vision attached to it. His vast experience, both on administration and even otherwise, is where he brought all those experiences together whenever he would guide us towards a new plan.
Right. Mr.
And I
Bagla,
remember even for Invest India, for example, there was a lot of discussion. He was saying, how do we strengthen the team? How do we bring in more training elements to the team? How do we give them that freedom that they can go and perform? And that meant a lot.
Right, Mr. Bagla, there'll be much to talk about Dr. Mohapatra's legacy there, but appreciate you joining us with your thoughts in the bulletin.
Thank you.
And with that, we conclude this bulletin. News and updates continue after a short break.